FNP 652 Final Exam Version 2 Newest 2026-2027 Actual Exam with complete questions and correct detailed answers. Question 1. PG 1. FNP 652 Final Exam Version 2 Newest 2026-2027. Actual exam with complete questions and correct detailed answers, verified answers, already graded A+, which are common hyperkinetic movement disorders: dystonia, essential tremor, Tourette's syndrome. Dystonia, essential tremor, Tourette's syndrome. Question 2. A patient reports trembling of both hands causing difficulty performing tasks with the hands. The provider notes symmetric, rhythmic movements which are present at rest and no other neurological findings. A history reveals that the trembling decreases when the patient has a glass of wine with dinner. What is the initial action? Prescribing a beta blocker medication. Prescribing a beta blocker medication. Question 3. A patient with Parkinson's disease, P, has been taking carbidopa, levodopa, Sinemit, with good results, but develops increased dyskinesia. Which drug will be added to this patient's regimen to help control this symptom? Amantadine. Question 4. PG2. A primary care provider suspects Parkinson's disease, P, in a patient. Which tests may be performed to diagnose this disorder? Presence of 2 cardinal signs which improve with levodopa. Question 5. What are common symptoms seen in patients with Parkinson's disease? Bradykinesia, festination, rigidity. Bradykinesia, festination, rigidity. Question 6. A patient who is near death is exhibiting signs of agitation, anxiety, and intractable pain. When discussing palliative sedation with this patient's family, what will be discussed? The fact that this is an intervention of last resort, the need for informed consent from the patient and family, the possibility that this measure may hasten death. The fact that this is an intervention of last resort, the need for informed consent from the patient and family, the possibility that this measure may hasten death. Question 7. When should palliative care be initiated by a primary care provider? As part of routine health maintenance. As part of routine health maintenance. Question 8. When using the 5 wishes approach to documenting patient preferences for end-of-life care, the provider will document which types of preferences, how much information to give various family members, the level of sedation versus alertness the patient desires, the people designated to make care decisions for the patient. How much information to give various family members, the level of sedation versus alertness the patient desires, the people designated to make care decisions for the patient. Question 9. PG3. A patient being treated for cancer has had chemotherapy within the past 2 weeks and comes to the primary care clinic with a fever of 38.5 degrees. What is the initial action? Obtain a stat CBC with differential. Question 10. What is the most important role of the primary care provider in cancer management? Counseling about healthy practices to reduce risk factors. Counseling about healthy practices to reduce risk factors. Question 11. An oncology specialist recommends placement of radioactive isotopes in capsules near a patient's tumor. What is this form of radiation therapy called? Brachytherapy. Brachytherapy. Question 12. Which chemotherapeutic agent classes are S-phase specific agents? Fluorouracil, mercaptopurine, methotrexate. Fluorouracil, mercaptopurine, methotrexate. Question 13. What is the purpose of radiation treatment prior to surgical resection of a tumor? To debulk the tumor mass. To debulk the tumor mass. Question 14. A patient who has non-Hodgkin's lymphoma reports a dull, aching back pain in the thoracic region for several weeks along with difficulty, PG4, walking. The provider notes an ataxic gait. What is the immediate treatment for this condition? Steroid therapy. Steroid therapy. Question 15. Which are considered oncologic emergencies in a patient with cancer, requiring urgent referral to an oncologist? Superior vena cava syndrome, syndrome of inappropriate antidiuretic hormone, tumor lysis syndrome. Superior vena cava syndrome, syndrome of inappropriate antidiuretic hormone, tumor lysis syndrome. Question 16. A patient is in the induction phase of chemotherapy just after diagnosis of cancer. Which prophylactic measures will help prevent tumor lysis syndrome? Select all that apply. Initiation of allopurinol, intravenous fluids of 3000 ml/day, rasburicase administration. Initiation of allopurinol, intravenous fluids of 3000 ml/day, rasburicase administration. Question 17. A patient is determined to have an unknown primary carcinoma after a metastatic lesion is found in the lymph nodes. A blood test reveals that the patient has microcytic anemia. Which diagnostic test will the provider consider next to help determine the primary tumor? Endoscopic evaluation of the upper and lower GI tract. Endoscopic evaluation of the upper and lower GI tract.